Thank you very much. That's my first slide. So I'm reporting on this project, which took the acronym MAGS. You can see it's concerned with healthcare staff. I'll see if my clicker works now. I need to. No. Can I have the next slide? Okay, so I'm getting an echo at the moment. Let's stop getting an echo now. So this report, it took the acronym MAGS, and that was because it was inspired by Dr. Mags Portman. You can see the front cover of our report there, and that's Mags Portman, who was a senior and kind of pioneering doctor in the area of HIV, who died of mesothelioma aged 44. And she'd been exposed to asbestos through her work as a doctor. And the report was published a couple of weeks ago now, and there's the link to it there. Lost my internet. So next slide, please. So the aim of this project was to look at the experiences of presentation, diagnosis, treatment and care for healthcare staff with mesothelioma. And it involved sort of three main stages. One was to review the literature to see what had already been said or researched in terms of healthcare workers and their experience. A second was a freedom of information request, which we'll come on to. And the third was a semi-structured interview with a number of former healthcare workers who had developed mesothelioma. Next slide, please. So in terms of how many NHS workers develop mesothelioma, we did this because there was the data that exists at the moment is based on this mesothelioma mortality by occupation, and in that document, the number of people with the number of healthcare professionals who've developed mesothelioma or who've died of mesothelioma is quite low, and that has kind of led to a conclusion from in that report there that healthcare is a relatively safe place to work, safer than average place to work. It says similar things with regard to teachers as well as a matter of interest, and mainly sticks to the idea that mesothelioma or asbestos is mainly of risk to those working in the traditional industries. And that didn't tally with experience of people, our awareness of Mags Portman, but also of quite a number of other people who worked with mesothelioma, including legal professionals who could see that there were more. Often they had more sort of healthcare workers on their own casebook than was sort of showing up in the official statistics. So we wanted to try and get a better idea of what the actual figures might be. And to do this, next slide, please. We put in a freedom of information request. And this was the way we did with this. People who have developed asbestos, who have developed mesothelioma due to asbestos exposure, will often take legal action. As we saw in the last presentation, about 50 or 60% of people will probably take legal action against their employers with a view to showing that they were negligently exposed to asbestos at work. So we asked the NHS Resolution, which is the body that deals with legal claims, how many current or former NHS employees had sued the NHS because they believed they had developed mesothelioma due to asbestos exposure at work. And you can see on the figures there, the sort of claims starting in 2004 and then climbing pretty steadily, with one particularly higher year in 2013-14, climbing from about 38 to last year 148. So these are all people who worked in the NHS and who have developed mesothelioma and believe that it was due to asbestos exposure at work. Now, if we can, if we have the next slide, if you compare the data from the ONS with this data, the time figure period isn't exactly the same, but between 2002 and 15, there were 177 deaths recorded of NHS professionals in the ONS data. And at the same time, there were 961 claims made against the NHS. Not all of those were successful because it's very hard to show that there's been negligence. It's not hard to show that there's asbestos in hospitals because almost all hospitals have got asbestos. What's hard to show is that your mesothelioma developed because of negligence with regard to that. But about half of these claims were successful. The other half were nonetheless people with mesothelioma who'd worked in the NHS. And remember, this understates the number of cases because, as we've seen from the previous presentation, not everyone makes a claim. The other thing about it was the rates of female death and claim with NHS staff are higher than male, which is an unusual pattern in mesothelioma statistics, but something that Steph was sort of alluding to in her presentation. And as we can see, the rate of claims is increasing. And one of the things that's sort of suggested in the literature is that there may be a third wave, what they're calling a third wave of deaths due to asbestos or of mesothelioma due to asbestos, where it started in mining, then moved into the sort of the industries where asbestos was manufactured and then used. And that we now may see a sort of peaking of mesothelioma in areas where asbestos is still present, such as schools, such as hospitals. Certainly the rates are not going down in the way that was predicted by the ONS a few years ago. They haven't given us the breakdown by occupation, so we don't know how many of these 961 were professional or ancillary staff. And we've requested that data, but been turned down so far. We're still kind of still asking that one. So that was one part of the study, but basically showed that there's probably a lot more mesothelioma around in the NHS, amongst NHS workers, than is suggested by the ONS data. We also, next slide, please. We also looked at the experiences of healthcare workers with mesothelioma. And in the literature, we only got, there's only data from healthcare professionals, and it's mainly from doctors, some from nurses, and a little bit from dentists. So there's no research that's looked at the experience of cleaners, porters, people working in the laundry and so on, where we suspect some of these cases are coming from. The lawyers know that that's where they're coming from, but there's no literature on that. And similarly, when we did our interviews, we actually only found nurses and doctors. We didn't manage to find anyone from any of the non-professional areas. What they suggested was the physical symptoms are pretty much the same. So things like pain, nausea, and breathlessness, as we saw in the first presentation. For some of the professionals, the meaning of these symptoms is different. Their awareness of what their significance is different, and in that sense, that there may be a stronger emotional reaction to those symptoms than others might have. So there tended to be quite strong emotional reactions to the diagnosis. exacerbated by those who did have knowledge of the condition. And actually, with that, a sort of a disappointment, or sometimes even an anger, that they had been working in healthcare and had been exposed to danger in those areas. A knowledge that that's probably where they got it from. There's a sort of loss of role that you see in doctors and nurses who suddenly become patients. It's very difficult for them. It's also difficult for their colleagues, and there were some examples of poor communication and poor care. And I do recommend that those of you who haven't looked at there's a YouTube video of Kieran Sweeney and his experience of care and the problems with communication, terrible communication sometimes that he experienced as a doctor with mesothelioma. I do recommend that you have a look at that. So there's a lot more detail in our report. Next slide, please. We make a number of recommendations, and you can probably divide them into those sort of three categories. Some of them are to do with monitoring, sort of following other groups like Meso UK, and I think it's action on asbestos awareness, or asbestos awareness. But the idea of better monitoring, the current guidelines on monitoring are flawed and dated, really, and they're not in line with best practice in Europe. We're suggesting, so that's the sort of improved management. Also suggesting sort of education of management and staff as part of mandatory training. In terms of care, one of the problems that was noted was that people who were formerly healthcare professionals sometimes get treated as though they're still colleagues in their own care rather than as patients, and some of the way they were, some of the sort of the way they were given information could often be quite brutal. So again, we have a number of other recommendations, but I sort of just picked those out. I think that's my last slide. Is there one more? So, no more slides, so it's not going anywhere. Okay, so yeah, so obviously there's a big sort of thank you to all those who took part. It was I really enjoyed doing the interviews. The participants were great, but it's those were the sort of recommendations from our report, or some of them. Thank you.